Welcome to another lecture by MedicoMedics. Pharmacology, Chapter 5, Autonomic Pharmacology. In this lecture, we will briefly review the autonomic nervous system, talk about its two main divisions, the sympathetic and the parasympathetic nervous systems. We will talk about agonists used in autonomic pharmacology and antagonists. Furthermore, why pharmacology is important, and end with a summary. Now, let's just briefly begin with an overview of the autonomic nervous system. And you can also check our physiology lecture, chapter number 9, where we dive into the autonomic nervous system. So, the autonomic nervous system is responsible for involuntary functions, things like heart rate, digestion, respiration, etc. It keeps the body running in the background without us needing to think about it. It has two main divisions. We have the sympathetic nervous system, which handles the fight-flight responses, so increasing heart rate, mobilizing our energy, etc., essentially preparing the body for action. Opposite to that, we have the parasympathetic nervous system. This supports the rest and digest functions, so slowing down the heart, stimulating digestion, conserving energy, etc. Then we have neurotransmitters. So the sympathetic nervous system primarily uses norepinephrine and epinephrine at the target organs, both of which amplify alertness and readiness. The parasympathetic nervous system, however, only uses acetylcholine throughout, promoting calming and restorative effects. Now, together, these systems maintain a dynamic balance, adjusting to whatever the body needs, whether it's to fight, flee, or recover. Next, let's see how drugs interact with the sympathetic nervous system. Now, let's zoom in on how the sympathetic nervous system works, especially through its alpha and beta receptors. Now, functionally, the sympathetic nervous system prepares the body for the so-called fight or flight. That means increased heart rate and blood pressure, dilating our pupils for better vision, relaxing airways for easier and better breathing, and reducing digestive activity. Now, these effects are mediated through adrenergic receptors, which respond to norepinephrine and epinephrine. Key receptors here include alpha receptors, so we have alpha 1 and alpha 2. We also have our beta receptors, beta 1 and beta 2. And here's how they break down. So let's take a look at this grand illustration right here. So here we have the neurotransmitter, epinephrine, norepinephrine. We see here 3 different receptors. So we have our beta 1, alpha 2, and alpha 1, just to illustrate topic. So if it binds to the alpha 1 receptor, the alpha 1 receptor activate the GQ pathway, leading to smooth muscle contraction and vasoconstriction. And this will elevate blood pressure. Another is binding to the alpha 2 receptor. So the alpha 2 receptors work through GI proteins to inhibit norepinephrine release. So a negative feedback mechanism that helps prevent overstimulation. What about the beta 1 receptor? So beta 1 receptors, found mainly in the heart, activate GS proteins to increase heart rate and contractility. We also could mention beta 2 receptors found in the lungs and blood vessels. These cause bronchodilation and smooth muscle relaxation, again via the GS and cyclic AMP pathways. Now, clinically, drugs, for example, like albuterol, which is a beta 2 agonist, are used in asthma to stimulate B2 receptors, leading to bronchodilation and improved airflow. So understanding receptor subtypes is actually key, both for predicting physiological responses and for choosing the right pharmacologic agent. Now let's explore the parasympathetic system and how drugs affect it. Now let's look at the parasympathetic nervous system, the rest and digest division of the autonomic nervous system. Now its primary role is to conserve energy and maintain homeostasis during restful states. Key functions include slowing down the heart rate, stimulating digestion and salivation, constricting pupils, a process called meiosis, and contracting the bladder, so aiding in urination. You can probably notice that it's pretty much the opposite of our sympathetic nervous system. Now, in the sympathetic nervous system, we talked about receptors like alpha and beta receptors. Here we talk about muscarinic and nicotinic receptors. It's also worth mentioning that these effects here are carried out through cholinergic receptors, which respond to acetylcholine. Again, in contrast to our sympathetic nervous system, where we have adrenergic receptors responding mostly to norepinephrine and epinephrine. So here we have these effects carried out through the cholinergic receptors responding to acetylcholine. And the receptors are the muscarinic receptors and the nicotinic. Now, the muscarinic receptors, these are G protein coupled receptors found on target organs, including, for example, on the heart, we have M2, we have M3 found on smooth muscle, and M3 found on glands. So, for example, M2 receptors in the heart, they will slow heart rate, while M3 receptors in the GI tract and salivary glands stimulate peristalsis and secretion. So these are the main drivers of parasympathetic responses at the organ level. Then we have nicotinic receptors. These are ligand-gated ion channels found at autonomic ganglia, where we have the NN type or subtype, and on skeletal muscle at the neuromuscular junction, the NM type. Now, in the parasympathetic system, NN receptors are located, as we mentioned, on autonomic ganglia, where they receive acetylcholine from preganglionic neurons to activate postganglionic neurons. And NM receptors, while technically somatic, are still cholinergic and worth mentioning. They mediate voluntary muscle contraction. As a clinical example, a drug like pilocarpine, which is a muscarinic agonist, stimulates M3 receptors to increase saliva and tear production, which is useful in conditions like dry mouth or glaucoma. Now, the parasympathetic system may act quietly, but it plays a vital role in recovery, digestion, and internal regulation, largely through the precise action of muscarinic and nicotinic receptors. So let's now look at agonists in autonomic pharmacology. These are drugs that mimic the body's natural neurotransmitters to activate either the sympathetic or parasympathetic systems. So sympathomimetics or adrenergic agonists, these mimic the effects of norepinephrine or epinephrine. And epinephrine activates all alpha and beta receptors. It's a broad spectrum sympathomimetic. And it's life-saving in conditions like anaphylaxis, where you need a rapid increase in heart rate, airway dilation, and vasoconstriction. Another example is albuterol. It's a more selective one. It targets beta-2 receptors in the lungs, acting as a bronchodilator in asthma, for example, or COPD. And contrast to that, we have parasympathomimetics, or cholinergic agonists. And these mimic the effects of acetylcholine. So for example, pilocarpine stimulates muscarinic receptors, especially in our glands. If you remember, the M3. Now, it's used to clinically treat glaucoma and dry mouth by increasing fluid secretion. So these drugs show us how we can selectively activate autonomic pathways to achieve very different clinical outcomes, from rescuing a collapsing airway to restoring salivary flow. Now let's look at drugs that block the autonomic nervous system, so antagonists. Now let's look at the flip side then. So antagonists in autonomic pharmacology. These are drugs that block the normal effects of autonomic neurotransmitters. So first we have sympatholytics or sympatholytics, also known as adrenergic antagonists. So these drugs block norepinephrine or epinephrine from binding to adrenergic receptors. For example, propranolol blocks both B1, so beta 1, and beta 2 receptors. And it's used to lower heart rate and blood pressure, making it useful in conditions like hypertension, angina, sometimes anxiety, etc. Prazosin blocks alpha-1 receptors, leading to vasodilation, and it's also used to treat hypertension, especially in patients with benign prostatic hyperplasia or BPH, as it relaxes smooth muscle in the urinary tract as well. Then we have parasympatholytics or anti-cholinergics. These block the effects of acetylcholine, particularly at muscarinic receptors. So atropine, for example, is a classic example. It blocks muscarinic receptors and is used to increase heart rate in cases of bradycardia. It also has ophthalmic and GI uses. So these drugs are essential tools to dampen overactive autonomic responses, whether it's slowing down the heart, relaxing airways, or drying secretions. Now let's consider how these drugs are used in some clinical scenarios. So let's finish with some applications. Now, if we're talking about sympathetic drugs, an example is albuterol, which is a beta 2 agonist that relaxes airway smooth muscle, making it a frontline treatment for asthma because it opens up the bronchi and makes breathing easier during an attack. Another one is epinephrine. So it activates both alpha and beta receptors, making it extremely effective in anaphylaxis because it improves breathing, blood pressure, and circulation. So it's a very life-saving intervention. And of course, opposite to that, just as we mentioned, we have the parasympathetic drugs. So atropine, used in surgery, for example, to reduce saliva production. It's a muscarinic antagonist. We also use it to treat bradycardia by increasing heart rate. Pilocarpine is a muscarinic agonist that's used to treat dry mouth, especially in Sjögren's syndrome, and to lower intraocular pressure. So it's also used in treating glaucoma. If we take a look at a case example, we have a patient with asthma who presents to the ER, let's say, with shortness of breath. We give them albuterol, which activates correctly the beta 2 receptors, relaxing bronchial muscles and improving airflow within minutes. So all these examples highlight how a deep understanding of the autonomic nervous system translates directly into targeted, life-improving treatments. So when we're talking about the sympathetic nervous system, the function is fight or flight, mobilizing our body for action. Main neurotransmitters here include norepinephrine and epinephrine, receptors alpha and beta receptors. The anatomy, which can be interesting, is that we have a short preganglionic fiber and a long postganglionic nerve fiber. Example drugs of this sympathetic nervous system include epinephrine, for example, used in anaphylaxis, and albuterol, used for treating asthma. Example drugs of antagonists, we have propranolol, which is a beta blocker, used in hypertension, prazosin, an alpha-1 blocker. So clinical relevance here, well, treating asthma, hypertension, anaphylaxis, etc. And in comparison, the parasympathetic system, rest and digest, conserving energy, supports recovery. Here the main neurotransmitter is acetylcholine. Receptors M2 and M3, so muscarinic and nicotinic. The anatomy here is actually opposite to the sympathetic nervous system, so the preganglionic nerve fiber is long and the postganglionic is short. Example drug, agonists here, pilocarpine, used to treat dry mouth or increase tear production, so used in also reducing intraocular pressure, used in glaucoma. Example drugs, antagonists here include atropine, in treating bradycardia, pre-op secretion reduction. It's very useful there. Clinical relevance, so used in bradycardia, dry mouth, GI bladder disorders, etc. And that's the end of our lecture. Thank you for listening. Continue now to chapter number 6.